It gives me a great pleasure to introduce Cynthia Milburn. Cynthia is the president of the Canadian Epilepsy Alliance, a Canada-wide network of community organizations dedicated to the promotion of independence and quality of life for people with epilepsy and their families through counseling and support services, education, advocacy, and public awareness. Cynthia has also been the CEO of Epilepsy South Central Ontario since 2010 and is the vice president of Matthew's Friends Canada, a charity specializing in medical ketogenic diet therapies for epilepsy as well as other neurological and metabolic disorders. As the CEA president and also a stakeholder, Cynthia's life is personally and professionally dedicated to epilepsy education and advocacy and fundraising for epilepsy support throughout Canada. She strives to be a notable leader in the community with a passion for helping people living with seizures and educating the community about epilepsy, all while a main priority continues to be a quest for funding solutions. And with that, I would like to turn the microphone and video over to Cynthia Milburn.
Thank you very much, Paolo. Good morning to all. Good afternoon out east as we settle into these scientific presentations that we all look forward to each year. I hope next year we're in the same room in Kelowna, and it is my privilege to address you today. The Canadian Epilepsy Alliance currently has 27 member agencies that represent all the provinces. We endeavor to collaborate wherever possible, sharing resources, including publications and new program details for all to use. I wanted to share some insight as to who we are and what we represent. The CEA membership is comprised of the epilepsy community agencies across Canada, providing counseling and support to people living with epilepsy, their families, and caregivers. We are the direct link to people living with epilepsy in Canada, and these agencies form a vital component of their comprehensive epilepsy care. The CEA is the official community partner with the Canadian League Against Epilepsy, where I have the privilege of sitting on this board. The CEA is the full voting member representing Canada at the International Bureau for Epilepsy, where our past president, Deirdre Floyd, is the sitting member. This entitles the CEA to also represent Canada as part of the North American Commission of the IBE, where Deirdre Floyd is vice president. The CEA are members of the Neurological Health Charities Canada, where Mary Secco is the sitting member. The CEA are members of Best Medicines Coalition, where Michelle Franklin is the sitting member. With the devastating effects of COVID-19 lockdowns, requests for services greatly increased, as the already isolated population we serve were and still are further isolated. The impacts of the pandemic negatively affect people with epilepsy in so many ways that the community agencies quickly moved to all support to virtual platforms, allowing individuals to access our support, be on group calls for not only counseling, but also for social interaction. Some agencies held game nights just for this reason. Many CEA agencies furthered their outreach by providing interactive professional webinars on various medical topics of concern, which many of you participated, which we are grateful for. These webinars were open to the whole country and are still available on some of our websites. The other huge COVID impact was the sudden cancellation of all of our fundraising events, which has been devastating. I want to talk about the non-medical burden of epilepsy. And in writing this and consulting with some of my colleagues, I'm really referring to our work as non-clinical care, mental health, disease management, reducing emergency room usage. We participate in most of the studies brought forward by all of you in the medical community who asked for either our input or through surveys sent to our client sources. What we do is health, a continuation of health. We are partners in a healthcare delivery, not in the clinical setting, but in the community setting. There are written provincial guidelines for the management of epilepsy care in Ontario, for example. The community epilepsy agencies are stated and shown in the flowcharts to be an intricate part of the comprehensive care of epilepsy patients, and yet there's no funding. We provide a community-based setting with a community-based focus, continuity of care, starts in the clinics and continues into our communities. The difference is economics. Medical care equals money. Non-medical care equals no money. Please think about all your patients who go to the ER unnecessarily, who call your office with feelings of anxiety and depression and need to talk. Increased PNES diagnoses takes approximately 18 months to see a neuropsych for a first appointment. Therefore, we, the community agencies, are the stopgap support. We need the neurologists and epileptologists to advocate on our behalf. And province by province, we will be asking you for this support. By supporting us, we free up your time for more patients. We provide the ongoing education to these patients. We are actively able to provide qualified mental health with ample funding. 5 years from now, our agencies could be gone. So I'm asking the medical community to please help us maintain and sustain our work. All while accomplishing this work, we are simultaneously in the event business, but we want to be doing the epilepsy care business. Fundraising events and activities are the only way to fund the core costs of epilepsy care in the community. Across the country, funding lacks despairingly. To the very best case scenario I can give you is Newfoundland and Labrador. Their thrift store, located in St. John's, is a social enterprise. It's massive, and it's not only providing job opportunities for people with epilepsy, it supports epilepsy care for the whole province. They are standalone. The Maritimes receive a nominal amount of provincial funding, I mean nominal, just from Nova Scotia. This agency covers all the Maritime provinces. They are incredibly underfunded. Quebec agencies do receive funding through the Ministry of Health and Social Services. They must, however, apply individually each time, and the ministry determines the amount based on criteria. The amounts allocated are helpful, but agencies still hold fundraising events to supplement. Ontario receives zero government funding and has been lobbying the province for over a decade now with a glimmer of hope as of late. There is no government funding provided through the prairies, and Alberta and BC receive a nominal amount of lottery proceeds. Each CEA agency is responsible for their own funding, applications, and resource development, and this is a daunting task. We ask the medical community to start by advocating for us and with us to your ministries of health, to champion funding for us through your voices. The management of epilepsy continuum in the community has a positive impact on our healthcare system. We are part of that healthcare system. We are not looking to divert any funding away from hospitals or the EMUs. We need health ministries to fund and find additional dollars now to services that will defer right back to the clinicians and back to them, the government, when we no longer can exist. We have a business case. Here in Ontario, we have been lobbying the Ministry of Health for dedicated funding for community epilepsy programs. As part of this effort, Epilepsy Ontario has calculated the potential financial impact of investing in the programs we deliver. An investment of $2.8 million per year for 4 years to fund programs in Ontario's community epilepsy agencies. This would not only pay for itself in reduced healthcare costs, it would create an additional $9.7 million in net savings within those 4 years. These healthcare savings would come primarily through eliminating 16,000 avoidable hospital visits at the emergency department and shortening inpatient admissions, as well as savings associated with improved mental health. These numbers are realistic and are based on rigorous academic studies of the kinds of programs our agencies deliver. Our challenge now is pushing the decision makers in the Ministry of Health to make funding of our programs a priority. Other provinces are using this data to lobby their provincial governments. We need your help to further making our case. The goal is to acquire additional funding, not take away existing. In the meantime, we would love to see all of you attending our events. Some of you do. This support from the medical community is so very much appreciated, and by showing your support, by attending these fundraising events, validates our work. confirms our worth and the difference we make in the lives of your patients, our clients. We don't know yet what the longer term effects of COVID will be. Added hospital pressure, unnecessary inpatient admissions, ER visits more often. I've been told the non-medical burden of epilepsy far outweighs the medical burden, but where's the line drawn? Positive mental health and well-being is the sustenance of our lives, and it is still health. With your help, we are able to sustain our work over the long term rather than bearing the burden of risking agency closures. I speak for the entire CEA when I say we are truly in awe of your brilliant minds and the amazing work you do for patients with epilepsy in the clinics. We are also so proud of the work we do. We are making a difference in people's lives, their quality of life, their mental health. We empower people with epilepsy to have confidence in themselves, to believe they are worthy of a good life. I thank you for allowing me to address you today.